So we've identified the problems or some of the problems. And, I mean, we hear people like yourself and many other physicians or people in healthcare complain about it. But you went a step further, Dr. Wallen, and you have some solutions. So what are those solutions?
Right. So, I mean, I went ahead and created Self-Directed Medical. Mainly, it's an education program for patients because, again, that financial knowledge for medical care is not there. And I think the reality is that, I got to stop saying that, but whatever. It really, truly is a problem of the corporate medical system, right? If you can get outside of that and still protect yourself as a patient, then you can achieve significantly lower prices and, get the highest quality possible care that's out there. And so from that standpoint, basically we kind of talk about 5 main pillars. One is, your day-to-day care, which, there's direct primary care out there which can offer a significant cost savings for folks. And it's as cheap as $1,000 a year for 24/7 access and access to, some extra things on top of that, wholesale meds, wholesale labs, what have you, that can save even for Medicare patients. I talked to a DPC down in Fort Myers the other day, Dr. Rebecca Bernard, who I think has been on your show as well. Mm-hmm. And she was saying that even for Medicare patients, she can actually save them money if they join her direct primary care practice. Just, for instance, if they have, 4 or 5 different medications that they're on, she can actually save them enough money that they pay for their membership just by, getting them access to wholesale medications. And so from that standpoint, that's huge, because again, Medicare, a lot of Medicare patients are limited in their ability to, kind of generate extra revenue or what have you. And actually, there's some AARP data that shows that Medicare patients, the two of you together, you and Janet, when you get into Medicare years between, say, 65 and 85 or maybe even 95 plus, however long you live, between that 20 and 30 years plus, most people will probably spend $230,000 to $340,000 out of pocket. And most people don't even have that saved for retirement alone, let alone for medical care specifically. And so if you can, kind of do that, or, even just, I know another friend of mine who has rheumatoid arthritis, and he actually saves more money every month on his rheumatoid arthritis medication through his direct primary care than he does, than what he pays for the membership. And that's just for 1 or 2 medications, I think, that he's on. And so that's huge. Plus also just think about it in just one instance, right? If you can call your direct primary care, if you got a cut in your hand, you can call them and you can avoid going to the emergency room because you have access. Again, not talking about coverage. We're talking about access and care, which is the most important piece. If you can call them, text them, telehealth anytime, or even, what have you, and avoid going to the emergency room and avoid getting that $10,000 or $15,000 bill for sutures or what have you, I mean, that's huge. So, and that's just one example, one time. So, that's a huge pillar for day-to-day stuff. Beyond that, for catastrophic coverage. So we have to have day-to-day coverage. We have to have catastrophic coverage for those big costs like surgery, like, admissions to the hospital, like emergency room visits, what have you. We also have to specifically talk about the 4 main things that patients typically get robbed on and find wholesale prices for them, which I'll mention in a bit. But beyond that, there's also financial accelerators like HSAs, like HMAs that can be helpful for that out-of-pocket costs. And then finally, it's really just trying to be as healthy as you possibly can to stay the heck out of the system in the first place, which is the 5th pillar. But so we talked about direct primary care, those catastrophic costs. I mean, sharing programs are great for that for families and individuals and even small businesses. There's also level funded plans, which can be helpful for kind of a little bit bigger businesses between 15 and 50 employees or so. And then beyond that, a lot of businesses will actually self-direct their care and basically have a self-funded plan where they take on the risk rather than paying somebody else to. But again, if you can couple some of these things, especially direct primary care and sharing. I mean, sharing is a great opportunity to save about 50% of your health insurance bill and potentially even reduce your deductible to $1,000 or so. Which again, if you can do that and save money, why not? Right? I mean, I think there's 1 million people across the country in sharing programs right now, and I would argue that we would be a lot better off if there was 50 million or 100 million people across the country, or even 300 million, all of us, if we could all get into a sharing program rather than these kind of mandated programs. I mean, even what Medicare Advantage and a lot of the Affordable Care Act programs, they don't even include the best doctors. They don't include the best cardiothoracic or, the best cardiologists. They don't include the best oncology folks across the country. And if you have a real bad problem like cancer or heart disease, which is also common, I mean, I think I actually just read a quote the other day that I think every 36 seconds somebody dies from cardiovascular disease in our country.
Wow.
And I think across the world, it's like 1 in 5 people die from cardiovascular disease, right? So that's a huge problem. But if you can actually get to the centers that are the most experts in it, or at least if you can find somebody close to you or what have you that will work with you directly and will kind of jives with you rather than being mandated into these tiny narrow networks that insurance companies make you go to so that they can make more profits. That's huge, right? I mean, ultimately you have to have a relation. It goes back to kind of what Janet mentioned about kind of that 1980s earlier medicine, that relationship-based medicine where your doctor actually knew you and knew kind of more about your life and about your health and had more time to spend with you. And that's what one of the biggest things that corporate medicine has kind of miscombobulated, because basically it's a numbers game in corporate medicine, right? So you have to get on as a clinician to make profit. You kind of have to get on the hamster wheel and just try to produce as much volume as you possibly can for the corporation, and that's not in the best interest of the patient, because you're getting a 10 or 15 minute max visit where you should probably have 30 minutes to an hour to truly kind of understand and go through, whatever you can possibly do to prevent having problems, right? So that's kind of that catastrophic stuff. Again, sharings are great. I mean, Zion's great, Sedera's great. There's a couple other ones out there that are good too, but level funded plans and self-funded plans are more for businesses, which certainly, to some extent, when you think about this, a lot of the folks that we try to work with are entrepreneurs or small businesses, because they actually have the power of choice, right? Because unless you're going to take the information that we give you and you're going to go to your employer and say, hey, you need to look at this stuff and try to advocate for yourself with your employer. A lot of your employers, especially the bigger ones, they lock you into whatever choices they offer you, right? So you don't have that power of choice as an employee a lot of times, which is unfortunate. But I think that hopefully we can change that with time by working on these employers. Again, then beyond that, I mean, I think direct primary care, again, going back to the first pillar, actually helps with the third pillar, which is, I mean, the four main things that people get kind of robbed on for price is images, labs, medicines, and transport. And at least 3 of those, you can probably get wholesale prices with your direct primary care. So medicines, labs, and images. And again, I think the biggest warning sign I could tell anybody is never, ever go to a hospital for images or labs or medicines if you don't have to. If you're not there for emergency care or you're not admitted, absolutely find somewhere else. Find an independent radiology place or an independent lab or an independent pharmacy and go get that stuff from them and not go to the hospital, because, again, they inflate the prices so much. I mean, your standard CT scan, $350, $500 across the country. I've seen horror stories of $10,000 or $13,000 for these same images at hospitals. And so, they jack up the prices so much, and that's, again, huge problem for patients. So, never ever do it if you don't have to. If you're not already in the emergency room or you're not admitted, it's not a reason to do that. Again, the fourth pillar is really kind of HSAs, HMAs, right? So HSAs, health savings account, a lot of people know about them, although there's not a lot of folks that are actually using them across the country. I think it's like maybe somewhere around 40 or 50 million now, which is still pretty low. But they quite honestly, I think an HSA, the good thing about them is it's tax deductible money, right? So it goes in pre-tax. So you actually can kind of save some of your money that way. But to a large degree, it's dollar for dollar when you're spending it. Although if you spend it for medical care, there's no taxes that are applied, but it's dollar for dollar coming out as it goes in. So quite honestly, I mean, it would be there's a great opportunity with an HSA to actually save money for retirement. Families can file away about $7,600. I think individuals are like $3,650 or something like that as of 2022. And you know, if you add that up over the years, the beauty of the HSA is it's triple tax free, right? So it's tax free going in. You can actually invest it in the stock market or other options, and you can actually grow that money through the years. And then it's tax free coming out as long as you spend it for medical care, or alternatively, once you hit 65, it actually, you can spend it on anything, and you can actually use it as a retirement account. The only caveat to that is you do get taxed based on your income if you spend it for other things other than medical care. But even so, I mean, even if you're able to save up $100,000 in an HSA over the course of your younger years, and you have that available for medical care as you're older, and we already talked about $230,000 to $340,000 for the average couple in their Medicare years for out-of-pocket expenses, right? So that's a great way to do that. I think personally, I think the HMA is a better out-of-pocket accelerator. It's basically a prepaid Visa card, which you prepay the contributions monthly. Over the course of about 3 years, the value of it actually doubles. And so, you know, you pay in, you know, shy of, you know, $20,000, and you end up with $40,000, which you can use for yourself, your spouse, and any dependents under 26 for all your out-of-pocket costs. And so then you're actually paying half off for anything that you're paying out of pocket at that point. And then you can kind of recharge it up throughout the years if you use it. So that's a nice way to kind of really kind of take advantage of some of the financial accelerators that are out there, and truly kind of save yourself some money as an individual or a family.